Hi friends, I'm Dr. Preeti Sharma, MD Pathology. Today we are going to discuss a very important MCQ of systemic pathology. Now the purpose of taking up this MCQ is because this particular MCQ firstly is a repeat question, so this will help us in solving a repeat question of the previous year. Secondly, this question not only is going to test your knowledge database in terms of your theoretical knowledge, but is also going to be integrated with the more upcoming trend of image-based questions. So this is in sync with your image-based question also, as well as it is going to touch upon your knowledge of the theory part of this particular topic. So let's begin with this question of systemic pathology. Now, the first thing that they have mentioned is that a 4-year-old male child. So I'll keep highlighting the key points in this question. 4-year-old male child presented with first fever and skin rashes. So these are two very important key points given in the question. So we are dealing with a pediatric lesion, pediatric age group, fever and skin rashes. Now the child has come to us, and on examination, the next finding that we note is cervical lymphadenopathy. So that is a finding that we have elicited. And on intraoral examination, this is the image that the examiner has shown to us. So partly the information of this question has been given. We have a 4-year-old child, pediatric age group. He has presented with fever and skin rashes. The third finding is cervical lymphadenopathy. The next finding, the examiner wants you to identify from this particular image of intraoral examination. So now let's take a halt over here before we proceed to the remaining part of the question. First, let's focus on this particular image as to what is the examiner trying to show us. So now students, in the same question, if you see that this image has a very striking resemblance to one of our favorite fruits, that is a strawberry. So this particular finding is known as the strawberry tongue. This is the strawberry tongue. So now if we want to briefly make a list of what the examiner has told us, we have a 4-year-old male child. There is complaint of fever, complaint of rashes. There is cervical lymphadenopathy. And we have a very classical finding, that is strawberry tongue. Now with all of these, it is a very classical case because this is the classical presentation of a disease which again primarily affects this age group only. So when you come across all of these findings and this classical image, a spotter image that you have, you are dealing with Kawasaki disease. So the first thing from the question that we need to infer is what is the disease that the examiner is trying to take you towards, right? Now let's get back to our question. We have a rough idea as to which disease we are talking about. Now let's see what the examiner wants to ask us. So the next part of the question, students, is which antibodies are seen in this disease? So what you first had to infer, which disease? And we've done that because this integrated all these symptoms clearly point towards Kawasaki disease. Even if these symptoms would not have been given, this particular spotter image that we have, very classical image for strawberry tongue that is commonly seen in Kawasaki. But the examiner wants to test or touch upon in what depth you have studied Kawasaki disease. So the examiner wants to ask you the antibodies that are seen in this disease. So students, we are considering the must-know topic. So now let's do the must-know details about this particular disorder. So what we are going to deal with is what are the must-know points? The must-know points for Kawasaki disease. And I've got a very simple mnemonic for you when you're dealing with Kawasaki disease. And I know mnemonics become hard to memorize because towards the end, you cannot recall which mnemonic was for which disease. So the best way of doing this is, if you can derive a mnemonic from the name of the topic itself, that would be the easiest to remember. So the mnemonic that I want you to remember for Kawasaki disease is the term Kawasaki itself. So we are going to deal with the same term, that is Kawasaki. So with every particular alphabet, we are going to have one important feature. That is the mnemonic that you need to follow. So let's take it up with each alphabet, starting with K. Now, the way you pronounce K, the first feature that we have is going to be phonetically similar to K, and that is conjunctivitis. Conjunctivitis. So these conjunctivitis and K, they are phonetically similar. So the first feature becomes conjunctivitis. Certain additional points about conjunctivitis that I want you to note is this conjunctivitis is non-purulent. It is non-purulent first and will affect both the eyes. That is, it is bilateral. It shows bilateral involvement, right? So the first alphabet is done. Next, we have in our mnemonic A. This A stands for lymphadenopathy. This stands for an adenopathy, that is particularly lymphadenopathy, right? So A for adenopathy. What additional point about this adenopathy do you have to note is that this is usually cervical. Not always, but mostly it has a predilection for the cervical area, the neck area. And these tend to be more than 1.5 centimeters in dimension. So the dimension is also an important part of the criteria of Kawasaki disease. It is lymphadenopathy, cervical or the neck region, and more than 1.5 centimeter. Now let's go on to the next alphabet, that is W. Again, this has to be dealt with in terms of phonetically similar. So the way you pronounce Kawa, that is the W, the same way you are going to pronounce vasculitis. Vasculitis. So essentially, Kawasaki disease is a type of a vasculitis. It shows vasculitis, and what additional do we need to know is that this tends to involve medium-sized vessels. Medium-sized vessels, right? So this is a vasculitis involving medium-sized vessels. Moving on to the next alphabet. The next A stands for the age. Now students, remember, age is a very important deciding factor in this disease, also a very important MCQ that you get in the exam. First and foremost, what you need to know is that this tends to involve or occur in children less than 5 years of age. Majority, 80 to 90% of the cases are in the age group of 4 to 5 years, right? So this is primarily a vasculitis of the pediatric age group. Now there is one controversial and oftenly confused question that we have over here. This, as we just discussed, is a vasculitis of the pediatric age group. But if a question comes, which is the most common vasculitis in children? So please remember that yes, Kawasaki disease is a vasculitis in the pediatric age group, but it is not the most common. In the most common answer, you will think of Henoch-Schönlein purpura, very commonly abbreviated as HSP. So we have two vasculitis when we are considering vasculitis in the pediatric age group. Two names should come to your mind. One, Henoch-Schönlein purpura. Second, Kawasaki disease. But out of these two, if you have to select the most common one in the pediatric age group, in that scenario, it will be Henoch-Schönlein purpura. Continuing and coming back to our mnemonic with S. Now, this is that particular alphabet of the mnemonic which is very important because a lot of characteristics will be summed up in this particular alphabet. The first one, these children show involvement of the skin, and in the skin they show polymorphous rash. They show polymorphous rash which primarily is seen affecting the trunk. So the first S that we have is the skin. The next S that we have stands for swelling. So these children will also show edema as a presenting feature, swelling or edema. And the last S is something that I'm sure everyone knows by now, a characteristic finding of the tongue, that is the strawberry tongue. That is the strawberry tongue. So when we are dealing with the S alphabet, you have to think of the skin, which will show a rash. You have to think of swelling, which primarily means edema. And the most classical image-based question, that is strawberry tongue. Moving on to the next alphabet of Kawasaki, the next A now stands for, which might just help you solve the question of the day, that is antibody. So Kawasaki disease children will show an antibody, and what is that antibody? It is anti-endothelial cell antibody. Anti-endothelial cell antibody, this is the antibody that is seen in what we are dealing with today. Anti-endothelial cell antibody is seen in Kawasaki disease. Moving on to the next alphabet, that is K. Again, this entire mnemonic was about similar sounding, phonetically similar words. So with K, you will now think of coronary artery. You will now think of coronary artery. A very commonly involved artery in Kawasaki disease, which I just told you is a vasculitis. So coronary artery will be involved, showing coronary. Because it is a vasculitis, I can say coronary arteritis. Vasculitis, itis means inflammation. Arteritis, again, itis means inflammation. So coronary arteritis is a very commonly involved vessel. This later can result in aneurysm. These are the complications that can happen: aneurysm, thrombosis, rupture, and the child may land up with myocardial infarction. So yes, myocardial infarction in this age group extremely rare, but we can always attribute Kawasaki disease to one of the major causes of myocardial infarction because coronary artery involvement is very commonly seen in Kawasaki disease. Finally, coming to the last alphabet of this particular mnemonic, that is I. And I now stands for two things. There is increase in two things that you will see. First, there is increased body temperature. So the child will have fever. Again, this is one finding that was given in our question. The second finding, again, a potential question, very important. On doing a complete blood count of a child with Kawasaki, it has been seen that there is an increased platelet count, which I can easily abbreviate as, or give a more scientific term, that is thrombocytosis. increased or elevated platelet count, that is thrombocytosis, and increased body temperature, that is fever. So if you remember the term Kawasaki, you can, with every alphabet and similar sounding, phonetically similar words, you can come to what all features will you see in a patient of Kawasaki disease. With this particular knowledge, let's try to get back to our question. The question that was put to us was, which is the antibody that is seen in the disease? And now we can easily answer the question, that is, anti-endothelial cell antibody is the antibody seen in Kawasaki disease. Whenever you have a question while you're practicing MCQs, make it a habit, students, that look at the other options, because the other options are going to help you in correlating or in making a bridge with other topics as well. So what are the other antibodies given? We have anti-SSA and anti-SSB antibody that is given, the first two options. These two antibodies are seen in Sjogren's syndrome. And how we can remember this is S and S in both of them is going to be Sjogren's syndrome. So this is definitely not seen in Kawasaki, and I hope with this mnemonic you will remember SS stands for Sjogren's syndrome. So these antibodies are seen in Sjogren's syndrome. The third option that is given to us is the ANA, anti-nuclear antibody. Now this is an antibody that is seen in many autoimmune diseases, but primarily the disease for which we consider it to be very sensitive is SLE, systemic lupus erythematosus. Remember, ANA is the most sensitive antibody that we have for systemic lupus erythematosus. So this is about the other antibodies. The antibody in our question, which was our answer, is anti-endothelial cell antibody. And once you've got this knowledge, finally we can come on to the criteria. What is the criteria for diagnosis of Kawasaki disease? So we've done all of the important features you had to know. All the important features are done. Now we just need to, from those features, select out which are the features which will help us in formulating a criteria. So the first important thing that you need to know has to be fever. The first important thing has to be fever. So fever has to be present. Along with that, we are going to take 5 criteria, of which any 4 should be present. So fever has to be definite, it has to be present. Along with that, out of the 5 criteria, if any 4 are present, we can label it as Kawasaki. And what are those 5 criteria? So you need to focus on these 3 alphabets. And this will also help you in recalling. K was for phonetically similar conjunctivitis. A was for adenopathy or lymphadenopathy. S that we had in Kawasaki was for the skin rash, first of all, was for swelling or edema, and for strawberry tongue. So these 3 letters, K, A and S, if you put them together, these are your 5 criterias of Kawasaki. Out of these, any 4 need to be present, and what definitely needs to be present is fever. That is when you will make a diagnosis of Kawasaki disease. And one thing that I want you to notice over here, there is involvement of the mucous membrane, because there is, for example, strawberry tongue, right? There is involvement of the skin in the form of a rash. So there is involvement of skin. There is lymphadenopathy, enlarged lymph nodes. So I'm going to put that term also. Kawasaki disease is also known as the mucocutaneous lymph node syndrome. So if you know the mnemonic, from the mnemonic you know the other name also. From the same mnemonic you know the criteria also. So all that you need to remember now onwards for Kawasaki disease is the word Kawasaki, and every letter of that word is important. Now students, one thing that is very favorite with the examiners or pathologists in general, all the pathologists consider pathology to be a very palatable subject. They love food, and all the food items are very commonly correlated with things that we see in pathology, right? So since we are talking about the strawberry, like we spoke about strawberry tongue, there are many other appearances with the same name that are given. So let's make a brief summary of all of these. Let's make this subject more palatable and let's make it more easy to digest over here. So the first one I hope everyone knows by now. Strawberry tongue is seen in Kawasaki disease. The next one is strawberry gums that you can easily appreciate. Strawberry gums is seen in another vasculitis, that is Wegener's granulomatosis. But I want you to put in one more thing in your knowledge database today, that Wegener's granulomatosis is now given the name of granulomatosis with polyangiitis. So, granulomatosis with polyangiitis, G for granulomatosis, G for gums. It will show strawberry gums. Next we have strawberry gallbladder. Again, it's not the shape of the gallbladder. If you see the mucosal aspect, it appears studded with these yellow dots. This is nothing but something known as cholesterolosis. Cholesterolosis of gallbladder gives a strawberry gallbladder appearance. This is nothing but the triglycerides and the cholesterol esters which have deposited in the lamina propria of the gallbladder. So that deposition of this cholesterol will give the appearance of a strawberry gallbladder that is seen in cholesterolosis. Coming to strawberry cervix, a bridge with gynecology. This is seen because of an infection, that is trichomonas. Trichomonas infection gives this characteristic studded appearance of the cervix, also of the vagina, that is strawberry cervix. Next, a bridge with dermatology. There is something known as a strawberry nevus. And students, although the name is nevus, this is actually said to be a capillary hemangioma. This is a capillary hemangioma, right? So you can see this large lesion over here on the cheek. This is a capillary hemangioma given the name of a strawberry nevus. Strawberry nasal mass is seen in rhinosporidiosis, a link with ENT. Strawberry shaped skull becomes your link with radiology because this is seen in Edwards syndrome. And I hope while linking with so many subjects, we've not forgotten the basic pathology, that Edwards syndrome is trisomy 18. E for Edward and E for 18. Edwards is trisomy 18, which has a strawberry shaped skull. The last two that we have is strawberry skin. This is seen in sarcoidosis. And strawberry rectosigmoid, the last one. Strawberry rectosigmoid is actually a link, again bridging it with surgery. This is something not related to the shape of the rectosigmoid, but again the mucosal aspect. The mucosal aspect, and also in case of Borrelia infection. But primarily remember spirochete. So this is a brief summary of all the lesions in the entire many subjects in fact, which can show a strawberry appearance, but primarily our question of the day, which was the main thing, that is strawberry tongue, that is seen in Kawasaki disease, and the antibody that was the answer to our question is anti-endothelial cell antibody, which is seen in this particular disease. So I hope this mnemonic and this summary of this particular strawberry appearance in various other subjects makes memorizing this particular topic easy for you, and I hope with this you can recall this in the exam as well. The subject becomes more palatable and easy to digest. Thank you.